Bacterial meningitis. A. Miguel Sandoval. B. Madison Vandervelde. C. Natalia Vitas and Lauren Alstrom. D. Luke Nelson and Mark Rossetti will be presenting. Part A. What is bacterial meningitis? Bacterial meningitis is a bacterial infection that causes inflammation of the protective lining in the brain and spinal cord. Some common causes are Streptococcus pneumoniae, Escherichia coli, Haemophilus influenzae, and Neisseria meningitis.
A Neisseria meningitis is a gram-negative encapsulated bacteria that's classified by its polysaccharide capsule. The capsule is important for its virulence because it allows the bacteria to escape phagocytosis and cell lysis. It's a diderm aerobic diplococcus, meaning it has two membranes in its cell envelope. It requires oxygen to grow and cannot survive long outside the body. And it has a rounded shape found in pairs. It uses pili to attach to host cells and retracts easily to be able to move along the surface. This bacteria also has surface proteins that allow it to adhere to and invade host cells. It's transmitted mainly via respiratory droplets or direct person-to-person contact. Many adults share similar symptoms to the common cold or flu, but most notably have a stiff neck and or a dark bruise-looking rash. Young children tend to have higher irritability, are overly tired, have a bulging or soft spot on their head, or simply refuse to eat. Neisseria meningitis bacteria attach and multiply in the naso and oropharynx, often without symptoms. The bacteria can penetrate through the mucosal lining and cross into the bloodstream, leading to a systemic infection. Once in the bloodstream, the bacteria are able to cross through the blood-brain barrier and enter the CSF and central nervous system. Once the bacteria affect the meninges, it causes a release of cytokines and immune cells, inflicting inflammation. Prolonged and intense inflammation lead to increased permeability of the blood-brain barrier, causing symptoms like cerebral edema and intracranial pressure. According to the CDC and the graph shown above, there has been a significant increase in reported cases, specifically broken down by serogroups. Due to its virulence factors, once it has infected a host, it is incredibly hard to get rid of. However, with the use of vaccines, and its spread has been more limited and manageable. Since meningococcal meningitis is so contagious, it's recommended to avoid people who are already sick, or if you are around them, wear a mask and frequently wash your hands. Vaccines have become more common and are often given to adolescents. With increased vaccination and more herd immunity, it has significantly declined the spread of this disease in the United States. Due to the bacterial having such a high genetic diversity and antigenic variation, vaccines are crucial to slow the spread and minimize this disease. If healthcare providers suspect a patient has been exposed to meningococcal meningitis, they might recommend starting antibiotics without a diagnosis due to its rapid nature. It's important to seek help immediately if signs of meningococcal meningitis are present. Antibiotics will be prescribed, often through IV. Corticosteroids can be used to reduce damage to the nervous system, IV fluids, oxygen therapy, and surgeries to treat dead or damaged skin. Meningococcal meningitis has a 10 to 15% fatality rate, and if it does not kill the patient, they are often left with long-term complications, not limited to physical, cognitive, and neurological damage. Patients are treated with antibiotics over 7 to 10 days, but can take weeks or up to months to fully recover, and that is if they ever do. People can get meningococcal meningitis more than once due to a compromised immune system, structural defects from the brain or spinal cord, or different variations of the bacteria.
So, for the biology of Streptococcus pneumoniae, it's a gram-positive cocci, but they're slightly oval shaped, but they're still considered cocci. And they grow in diplococci pairs, also known as short chains. They're facultative anaerobes, so they can grow without oxygen. And their cell wall is very unique because it has teichoic acid and lipoteichoic acid. So, and then there's also a capsule, which is an important virulence factor because it helps bacteria escape through phagocytosis. And then that's actually what the vaccines target. The vaccines target the capsule. And some other virulence factors of it are pili and pneumolysin, which some strains have. For transmission, many people are carriers and don't even know because they won't be sick with the illness, but it spreads person to person directly through secretions, and respiratory droplets. Some common ways of spread are close contact, shared items, coughing, and sneezing. Most people will come in contact with it, just become carriers, and only the people with weakened immune systems or compromised immune systems will actually get symptoms. The people who actually do get sick with it um, will experience sudden high fever, stiff neck, severe headache, nausea, photophobia, and then altered mental status and seizures. But for young children and mostly like babies, they experience stiffness in the body, extreme sleepiness, poor feeding, irritability, constant crying, and bulging fontanelle. And then for prevalence, due to a vaccine, very few people still get this, but for the people who do get it, 1 out of 12 kids and 1 out of 6 adults die from it. And the people who don't die from it often get long-term complications such as um, hearing loss, permanent brain injuries, and seizures.
Pneumococcal meningitis is caused by Streptococcus pneumoniae. It usually starts with colonization of the nasopharyngeal pharynx, where the bacteria are part of normal respiratory flora. When local defenses are weakened, for example, by like an upper respiratory infection, smoking, or any chronic illness, the pneumococci can invade through the mucosa into the bloodstream and then cause bacteremia. The polysaccharide capsule is the key virulence factor because it protects the bacteria from phagocytosis and complement. From the blood, they can cross the blood-brain barrier and enter the cerebrospinal fluid. In the CSF, there's not a lot of immune clearance, so they are able to multiply super quickly and trigger a very big inflammatory response, which that is what causes the brain to swell. It increases intracranial pressure and then decreases cerebral blood flow, which again can lead to complications such as cerebral edema, strokes, and then CV damage. And then it's best prevented with pneumococcal vaccines. Conjugate vaccines are given in childhood to high-risk adults, along with polysaccharide vaccine in older adults, which can greatly reduce invasive disease and also cut down on any carriage. Reducing risk factors also helps, such as smoking, heavy alcohol use, and promoting or promptly treating pneumococcal ear and sinus infections or pneumonia also lowers the chance that bacteria will reach the bloodstream and the meninges. When pneumococcal meningitis is suspected, it's treated with a medical emergency with immediate high dose intravenous antibiotics, typically a third generation cephalosporin, plus another drug to cover resistant strands, and often with early dexamethasone to limit inflammation to the brain. Even with good therapy, the infection still has a significant mortality rate. It's usually 1/6, so 15 to 25%. And many survivors are left with complications such as hearing loss, seizures, learning or memory problems, and but widespread vaccination has able to really reduce those numbers and improve treatment super quickly.
Haemophilus influenza type B meningitis is caused by the Haemophilus influenza bacterium, which is a gram-negative coccobacillus with a polysaccharide capsule. There are 6 different kinds of polysaccharide capsules, the one that causes this being type B. Type B has a polyribosyl ribotyl phosphate capsule, which is a large virulence factor. Transmission of the bacterium is often from person-to-person contact, which is inhaling respiratory droplets. HIB meningitis has many common symptoms, such as fever, irritability, lack of appetite, stiff neck, and drowsiness. A more noticeable symptom could be a bulging fontanella in infants due to the swelling of the brain. HIB used to be the leading cause of meningitis in children under 5 and was extremely prevalent. But since the vaccine, it has been very uncommon.
Haemophilus influenza type B or HIB causes meningitis by using several key virulence strategies. The most important feature is its PRP capsule, which allows the bacteria to evade phagocytosis and survive long enough to spread in the body. HIV usually begins by entering the upper respiratory tract through inhaled droplets, and once it reaches the nasopharynx, it can colonize the mucosal surface because of its capsule. And obviously, because of its capsule, the immune system has a hard time clearing it at this early stage. From there, HIV can move into the bloodstream, causing bacteremia. When the bacteria are circulating in the blood, they have an opportunity to cross the blood-brain barrier. After entering the cerebrospinal fluid, they trigger strong inflammation around the meninges, which leads to symptoms such as stiff neck, fever, drowsiness, and in infants, the bulging fontanelle, as described before. Before vaccines were available, HIV was one of the most common causes of bacterial meningitis in young children, but but now it's extremely rare in countries with routine immunization. The HIV conjugate vaccine is the main form of prevention. It works by linking the PRP capsule to a protein carrier, allowing infants' immune system to recognize the capsule and form strong, long-lasting immunity. Routine childhood vaccination programs have also proven to be highly effective. When communities maintain high vaccination rates, even unvaccinated individuals such as newborns or people with weakened immune systems are protected because the bacteria have fewer opportunities to spread. Overall, HIV meningitis is now largely preventable, and the dramatic decline in cases is directly linked to widespread use of the conjugate vaccine. This makes HIV an important example of how vaccination can transform public health outcomes and protect vulnerable populations.
In the Christian worldview, sickness is a part of the fallen sinful world. Falling ill does not mean it is a direct consequence of our sin, but is just part of this fallen world. Medicine and our intellect to make them is a gift from God, and when ill, we should pray for healing, though it may not always come, but God's comfort will always be there. Jeremiah, Jeremiah 30:17 says, "But I will restore you to health and heal your wounds, declares the Lord."